playing your favorite sports, maybe basketball or soccer, and suddenly you fall and land awkwardly on your hand. You feel a sharp pain in your hand, in your wrist. This could be a wrist sprain, one of the most common injuries in both competitive and recreational sports. In this guide, we'll explore what a sprain is, how it happens, especially in sports, what symptoms to look out for, and most importantly, how to treat it properly and prevent it from happening again. What is a sprain? A sprain, okay, is when the ligaments, which is basically the top bands of tissue that connect bones together, are stretched or torn in the wrist. This happens when the joint is twisted or bent beyond its normal limits. Sprains range from mild, a small, simple stretch, to a severe, complete tear of a ligament. How can a sprain happen in sport? Well, wrist sprains are especially common in sports that involve falling, catching, or impact. These sports include soccer, basketball, gymnastics, skating, and rugby. When an athlete falls on an outstretched hand, the wrist absorbs the force, which can push it beyond its limits. There are six main symptoms and signs of a wrist sprain. The first one being pain, the most immediate sign of a wrist pain or joint, especially when moving it or pressing on it. The pain may range from a dull ache to a sharp stabbing sensation, depending on how severe the pain is. The next one is swelling. Swelling occurs when the body sends fluids into the injured area to protect and begin the healing process. This can make the wrist appear puffy or enlarged, and it may feel tight or tender the touch. Bruising. Bruising is caused by a tiny blood vessel breaking under the skin due to ligament damage. A sprained wrist may show purple, blue, or yellow discoloration around the injured area within a few hours or days. Weakness. A sprained wrist often feels weak and unstable. You might find it difficult to grip objects or support any weight on that hand, as the ligaments are not holding the joints firmly. The last but not least, limited range of motion. Sprains can make it hard to move the wrist fully. Bending, rotating, or lifting may hurt. The stiffness occurs as the joint tries to protect itself from further harm. The last one is popping or tearing sensation. At the moment of injury, you might feel or hear a pop or a snap that can indicate which ligament or was outstretched or partially torn. If a wrist sprain does occur, we can prevent it by following these steps or doing these. Well, we can firstly strengthen wrist muscles. Doing resistant exercises improves wrist support and helps prevent injuries due to strain or impact. We can warm up before sports. Gentle stretching of the wrist can help it from joints or ligaments to tear. We can also wear protective gear. Without the protective gear, our skin is just bare and open. A silent hard touch can rip and tear ligaments. We can also use proper techniques. Learning how to fall safely and effectively using the correct form in sports reduces the risk of landing awkwardly on your hands. We can also listen to our body. We can't ignore discomfort or fatigue. Rest if your rest feels sore to avoid overuse injuries. That's it. There are many ways to treat a wrist sprain, but today's one we are using the RICE method. The first R, which is rest, is stop using the wrist and avoid any activity that causes pain. This gives the ligaments time to heal without added strain. Immobilizing the joint for a short period can prevent further damage. The I in RICE is ice. Apply ice wrapped in a cloth for about 15 to 20 minutes for every few hours for the first 48 hours. Ice reduces swelling and numbs the area, helping to manage pain and limit tissue damage. C for rice is compression. Wrap the wrist with an elastic bandage or wear a compression brace. This helps reduce swelling and supports the pain and, most importantly, reduces movement of the wrist. Make sure the bandage is snug but not cutting off circulation, as if it is cutting off circulation, you may get worse. Elevation. The last point of rice is elevation. Keep the wrist raised above heart level, such as on a pillow. This helps reduce fluid building up and swelling by allowing blood and fluids to flow away from the injured area. Sources: Cleveland Clinic, a leading academic medical center in the U.S. Cleveland Clinic offers professional guidance on injuries and rehabilitation supported by medical research. Health Direct Australia, an Australian government-supported website that delivers reliable health advice from registered health professionals across the country. It's the final minutes of the game. Here he comes one-on-one with the final goalkeeper. Here he goes. He takes a shot. He misses. The goalkeeper saves it. Oh no! The goalkeeper is in pain. Oh no! What happened?
I think I sprained my wrist.
It seems like the victim has sprained her wrist. In these situations, it's important to remain calm and assure the victim help and tell them that you are here to help. I approach Ashfia and tell her, Ashfia, you had a tough fall there. I think you have a sprained wrist. It's okay. You can trust me. I'll help you.
Okay.
Staying calm reduces panic and helps the injured person to find trust and ensure trust and allows you to provide help. Step 2 is assess the injury. We have to begin by gently asking Ashfia questions softly so that she ensures us a more suitable answer. As you can see, we have taken the victim and allowed her to sit in a 90 degrees position, allowing more blood flow to run through her arm. We can ask questions such as, hey Ashfia, did you hear any popping or snapping in your wrist?
No.
Can you move your fingers for me?
Yeah, I can.
Where does it really hurt?
Just around here where I fell.
These questions allow us to find where the seriousness and where the injury is mainly targeted at. We can look at the wrist carefully. Is it swelling, bruising, or if she can't move the fingers? As we have taken Ashfia into an upright position, it is already helping us to do blood flow running through, and it avoids more tissues and ligaments breaking or ripping or stretching in her wrist area. We can start by asking if she is not already seated. We can ask, let's get you seated, Ashfia, and you can rest at your rest. The goal of this is to cause any more stress to the ligaments or surrounding tissues. That's it. Step 4 is to apply the ice to the injury. Quickly locate an ice or cold compress on the affected area through a cold cloth or any sort of cloth to avoid less injuries. We can do this by keeping it on the injury for around 15 to 25 minutes every single hour. We can always start by asking, Ashfia, I'm going to apply ice. This will slow down the swelling and allow you to feel better for about 15 to 20 minutes. Then we can check again after that. That's it. Step 5 If there's no ice pack around, we can always use compression. A towel, any sort of cloth can work for this experiment. After the initial icing, if you have already iced it, gently wrap the wrist of the affected area with a bandage or elastic sort of a substance to keep it supported. This helps to reduce the swelling and stabilizes the wrist to prevent further injuries. I'm wrapping your wrist now. Then we can start by saying, I'm wrapping your wrist now. You might feel a little snug, but tell me if it's too tight. By reassuring that if it's too tight, right, we can always let loose a bit so that the blood circulation can flow through her arms from this side to this side and allow more better circulation. Because when Ashfia's wrist is too tight, it can cause further injuries and more pressure to her wrist. After wrapping with compression and allowing ice, we can see that we can finally elevate the wrist. While sitting or lying down, Ashfia can put her arm on a backpack and pillow to allow less tension and stress on her wrist and keep it above level of her heart rate. Elevating the wrist helps reduce swelling or letting excess fluid drain away from the injury. We'll prop your wrist up a bit, allowing it so that the swelling doesn't get worse. We can tell to Ashfia. We can encourage her to stay still and lower her hand, and that could reduce swelling and more injuries out there. After doing all this elevation, compression, and applying ice, we can inform an adult if they are not known to the circumstances. We can let the coach, teacher, or first aid officer nearby to take them in and fill them in on what had happened immediately. You should explain that Ashfia needs medical attention if the pain is intense and the wrist looks bent or she can't move it at all. She may need an X-ray and to check for fractures or broken ligaments or ligaments tear. You've done great, Ashfia. Now you should be safe now. We're going to get you checked by a doctor. Tell us how serious it's going and how long it's going to take to heal is what we can say to Ashfia, allowing her reassurance and telling her what we're going to do next. Depending on the severity of the injury, she might need a brace, rest, or even physiotherapy. There you have it, guys. That is how to control a wrist sprain. Well, there are also a few important reminders that I would like to give in a wrist sprain situation. We should never let the victim or the injured person tell them shake it off or continue playing with, as the injury may get worse and it goes sportsmanship like. Always apply ice first, then compress, then elevate. You must do these three in order. Seek medical help even if the inquiry looks mild. Sprains can worsen without proper care. Lastly, be gentle and supportive and calm, allowing assurance to the victim, and your attitude helps the injured person feel safe and in control. In summary, wrist sprains are serious and are common and can happen in almost any sports. Knowing how to recognize and treat them quickly using the RICE method, as I had explained earlier, can prevent long-term damage and speed up recovery. Always seek medical advice if the injury looks serious. Thank you very much.